Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Fast. So what is meant by fast? Fast means it is a focused assessment with a sonography for trauma. So this is the full form of fast. It is an emergency ultrasound. It is a emergency ultrasound, and it is performed rapidly in 2 to 4 minutes. Next is it is assess the patient the potential sites. So assesses the potential sites of the thoraco-abdominal injuries, and it is known as the 4 P's. So what is meant by the 4 P's? So assess the potential sites of the thoraco-abdominal injuries, that is the pericardial sac. Next is you go for the perihepatic region, so hepatic, the splenic region, as well as the pelvis. So these are the areas we look into. Next is in case of the traditional fast views. So there is something known as a traditional fast. So traditional fast means there are 4 views. 4 views. There is a right upper quadrant. Next is there comes a left upper quadrant view. There's a suprapubic view. So right upper quadrant, left upper quadrant, suprapubic view, as well as there is presence of the pericardial view. Now let's look into what is known as the extended fast. A quick view on the E-fast, that is a extended fast. So E-fast or the extended fast, so they have additional views. So traditional, we saw there is a right upper quadrant, left upper quadrant, suprapubic, and the pericardial view. Whereas in the extended fast, there is also a right thoracic view and the left thoracic view. So right thoracic view and the left thoracic view. So what is the indications? The indication is it can be penetrating. So penetrating heart trauma can be seen. There can be a closed heart trauma, which also can be seen. There is a closed abdominal trauma and the chest trauma, pneumothorax, as well as the hemothorax. So what is the advantage of this? The advantage of the E-fast is it is it is a non-invasive. So it is non-invasive. There is no radiation exposure. There is also, it is quite rapid. It is portable. It may be repeated, as well as there is a very high specificity. To learn and grow daily like this, please do subscribe.